After programs are conducted and people participate, what happens next? How do we know that programs are successful and sustainable? We're not just talking about how many flyers were printed or how many events were held, but rather how will advocacy programs last forever? What is the secret to engaging the next generation to continue these advocacies? Hello, I am Miel, and I'm currently a doctorate student in communication. Today, we're zooming into a powerful tool in advocacy, communication, and social mobilization, or ACSM, which is the monitoring and evaluation, or M&E. Good data doesn't just appear. It requires a strong, well-managed reporting system from the community level all the way up to the national M&E units. Every level of the system has to be connected and working smoothly. M&E isn't just about tracking activities. It's about making sure those activities lead to impact. Monitoring and evaluation helps measure what matters most. Did the advocacy change behavior? Did it improve access to health services? Did it influence policy or funding? According to the Advocacy Evaluation Framework, successful M&E provides feedback that can shape strategy, improve program delivery, and ensure accountability to funders and the public. It links the effort with the effect. Let's now bring the concept to life through a real-world case study. The province of Bohol, which is located in Visayas, Philippines, has a human population of 1.13 million and was the fourth highest region for human rabies death in the country. It was averaging around 10 per year prior to the initiation of the Bohol Rabies Prevention and Elimination Project, or the BRPEP. In Bohol, the BRPEP shows how effective monitoring and evaluation practices can drive public health results. The project didn't just run education campaigns or vaccination drives, they also tracked results. They used a combination of quantitative and qualitative methods to assess their efforts. In Bohol, quantitative methods, as defined, are approaches that focus on numerical data and statistical analysis to measure tangible outcomes. Pre and post test. So pre and post tests are designed to measure knowledge, attitudes, or behaviors before and after a campaign or intervention. So in the project, the pre and post tests measured changes in community knowledge and awareness about rabies before and after intervention. So the survey they used is the Knowledge, Attitude, and Practices, or CAP survey, that was conducted in 2009 to evaluate the educational knowledge of the population. So this method helped quantify shifts in public understanding of transmission and prevention of rabies in humans. In case reporting, this means the documentation of program-related outcomes such as cases detected or services utilized. This method tracked the number of reported human and animal rabies cases in the program. What they found out was that between October 2008 and November 2010, there were no human and animal cases of rabies. Increased surveillance on the island detected one suspected human rabies case in November 2010 and one confirmed case of canine rabies in April 2011. Through consistent data collection, the project monitored reductions in cases over time, which confirmed intervention success. Dog vaccination coverage data, defined as data used to track participation and reach of a health campaign. This method calculated the percentage of vaccinated dogs in each barangay. In Bohol, vaccination rates increased from 44% to 70%, contributing to zero human rabies deaths in several districts. Qualitative methods. These methods aim to understand perspectives, beliefs, and behaviors through descriptive data. Focus group discussions, or FGDs. FGDs are defined as structured conversations with selected groups to explore perceptions, attitudes, and social norms. In the program, the FGDs were executed in Bohol and held with local leaders, pet owners, and health workers to understand barriers to dog vaccination and community involvement. So, what did the program gain from conducting FGDs? They found out that the many residents feared the side effects of vaccines or they did not understand the importance. This led the program team to produce culturally relevant information, education, and communication, or IEC materials like flyers in local dialects and stories from trusted community members. Key Informant Interviews, or KIS. KIS are defined as in-depth interviews with individuals possessing specialized knowledge or involvement in a program. This method captured detailed viewpoints from key stakeholders, who are the veterinarians and local officials, on program implementation, challenges, and success factors. Community mapping. Community mapping is defined as a participatory tool used to identify resources, needs, and risk areas. This method identified high-risk areas and informed the customization of outreach efforts. It helped visualize which zones required targeted interventions and resources. But the journey wasn't always smooth. M&E comes with challenges, especially in resource-limited settings. In the Bohol Rabies Vaccination Project, they faced issues such as delayed reporting, limited staff capacity, and logistical difficulties, especially in reaching far-flung areas in the region. Good thing that they address these by forming strong partnerships, conducting regular training, and involved local government units and schools to widen reach and improved accuracy. M&E helps ensure that advocacy, communication, and social mobilization, or the ACSM, programs aren't just temporary fixes, but rather they are sustainable, inclusive, and transformative. With the right tools, real participation of real people involved, adaptive strategies, change becomes measurable and possible. Because in advocacy, the real win is not just being heard today, but making the message live on tomorrow for the next generation to come, and hopefully for more generations to benefit from a rabies-free world. Thank you again for engaging with me in this discussion. I'll see you again for another insightful talk about social matters. Once again, this is Mel, your questing scholar. Goodbye!